Hello, my name is Alasia. I'm a certified substance use counselor, and I'm making these educational videos in order to increase the quality of substance use treatment worldwide. Today, we're going to be talking about things to look for in an intake assessment as a counselor. So, a lot of people, and I've had the privilege of not only doing a lot of assessments, many assessments, intake assessments, but I've also witnessed other people doing assessments, multiple people. Most people just go through the questions just one after the other, just trying to get it done. And a few will ask some follow up questions or make little comments here and there just to not make it feel so rigid and to build some sort of connection. But most people are like concerned with, like, let's get through all of these questions. And what's so interesting about that, I've been in more than one facility. So I've seen in facilities where they mostly take private insurance and the assessment is like a quarter of the length, whereas a facility that's like funded by the county or it takes a lot of patients who have like government insurance. There's all these questions that the county requires you to have, or whatever organization is behind that. So I understand why they're trying to get through the questions. And also, like, an assessment can just not be the most interesting thing for a patient to do, and it could get long and drawn out. So I understand. But there are some things that you really need to be looking out for during an assessment. And part of the reason that people don't look for these things that I'm going to be talking about today is one, a lack of education, because just the education to become a substance use counselor is very limited. And there's so many other things that are so important that they should know, they should be teaching, but it is what it is. And hopefully that will change sooner than later. But some people may have the experience and additional education to be able to look out for these things. And so these are just all things that you want to be screening for, because they impact a person's treatment, they impact how they'll navigate treatment and all things like that. So the first thing that you need to be looking out for during an intake assessment is a person's comprehension. So are they able to comprehend what you're saying? So if they're asking a lot of questions, or they are giving responses that don't align with the question, that's something to take note of. Because the first few times they do it may just be they're not understanding you clearly for whatever the reason. But if you see that continue to be a pattern, that's something to make a note of, because them struggling with comprehension, it could be due to a variety of things. Maybe it could be a learning disability, a cognitive difference, a developmental delay, something else, an intellectual disability, or maybe they are in withdrawals or something, or maybe they're intoxicated to a certain degree. Like, whatever it is, it's just something to make a note of, because that will affect how they understand things in group. It'll affect when you're giving education and all that kind of stuff. And we want to be mindful, because people in that category, they're going to have special and unique treatment needs. And so we want to be very aware of that. So that's the first thing. The second thing is psychotic symptoms. So you want to be looking out for psychotic symptoms. So I will say that a lot of people know if someone's hearing or seeing things that are not there, that's something to really make a note of, really report to the clinical staff, and be mindful of not just putting someone through the treatment pipeline or the treatment continuum of care, like, getting them the help they need right away with that. So a lot of people recognize that, but one that I see constantly people not understanding are delusions, which are fixed false beliefs. A delusion could be something like someone is the president of the United States, or Jesus Christ, or something like they're the long lost daughter of Michael Jackson, something that obviously doesn't make sense. So those are like the extreme end of it, but it could also be them telling really long, lengthy stories that don't add up. You're like, wait a second, that makes no sense. You said this, but you said that, and that's illegal, and why did the judge do that? Like, something that doesn't make sense. It's not just a story to chat with your coworkers and be like, they said this. Like, I can't believe they said this. Like, no, that's a delusion. That's a psychotic symptom, and that's something to be made a note of, because people who are psychotic and having those symptoms actively need to be referred to mental health professionals. They need that first. Before, they should not be put into an outpatient group by any circumstances. They need that treatment. So in the meantime, there needs to be some sort of protocol to help that person and not just throw them into a group. That doesn't make any sense. They need particular treatment. And so it does everyone a disservice, not just the patient, but even the people in the group witnessing someone that obviously something is not right. And most people, a lot of people will not say anything, but some people just don't have the education and understanding to help to be sensitive and empathetic towards that. So it could just be frustrating to them. So that's just not a person who's appropriate for group. The third thing, you want to be looking out for trauma responses. And so a trauma response is pretty much, it's subjective in many ways, but when someone's having an obvious emotional, extreme amount of emotional discomfort as a reaction towards something you say or while talking about something, that's something to make a note of. So, for example, if you're asking the trauma question and someone has a very strong response, they start crying or they get really defensive or they just express like very angrily that they don't want to talk about that. Now, of course, you don't want to push anyone to talk about anything that's going to trigger them. You don't want to do that at all, but that is something to make a note of. You could always tell them, express empathy and say, I see that this seems like it's hard to talk about. You definitely don't have to go into it. We can move on to the next question. And so that one's a lot more obvious because it's literally a response to the question about trauma, but someone could have that reaction to other questions that you may think it's like weird or odd that they're having such a strong emotional response to any random question. That's something to make a note of because you don't know what their history is. This is your first time meeting them, most likely. And so you don't know what their background is. So just make a note of that. What their response was. Did their body tense up? Did their eyes fill with tears? Did they, was their voice cracking? Were they fidgeting and just obviously having a very strong reaction to the question? Did they get really angry and hostile? That's something to make a note of because that's things you want the staff to be aware of. That's indicates that they really need to be referred to a therapist. Now, it's not your job or responsibility as a substance use counselor who's not a therapist and even if you were, an intake assessment is not the appropriate time to do a trauma session, especially as a counselor who's not a therapist, a licensed therapist or qualified as a therapist. But it is something to be mindful of, not only for staff, but in terms of referring to them to the appropriate provider. Another thing is experience in previous treatment episodes. You want to make a note of that, not just when they did treatment, where they did treatment. All intake assessments in substance use treatment ask about previous treatment episodes and usually ask the details, the year, how long you were there, how long did you stay sober afterwards, things like that. But you don't want to just ask those basic questions. You want to ask about their experience in treatment. What I mean by that is, did they like treatment? Did they get anything out of treatment? Were there certain programs they liked and certain programs that they didn't? Did they have a good experience in treatment? Did they benefit from it? And that will just give you an idea of their experience beyond just the details of when and where. Like, what was their actual experience? Because that will influence their experience now. It's even a good opportunity to ask, hey, you had these previous experiences in treatment and you said they went this way. What is your mindset towards treatment now? And that's something to make a note of and put in the summary of the assessment, because an assessment is not just supposed to be getting all these details, but really understanding who is in front of you and what are their unique needs. The last thing, number 5, is you want to ask what their thoughts about recovery and what it takes to stay sober. So what is their perspective of working a program? What is their perspective of utilizing resources? How have they been able to stay sober in the past? What worked for them? What didn't work for them? This is also an opportunity to find out what gaps they have in their knowledge about recovery or what misconceptions they have. Maybe they can't stay away from women. They just love women and that's always their downfall, but they're not aware of that. But maybe you pick up on that and you ask more about that. Like, hey, like, I see that usually, based on what you said, usually your downfall is when you're having a girlfriend. So just ask, like, what do they think it takes to stay sober? What's their experience in the past? What is their plan and intentions now? Like, what are their plans and intentions now? Because you want to know, like, are there any opportunities for growth and education? Or is there any opportunities for doing something different or making sure you're having stronger boundaries? You just want to know all of that. And so those are the things I want to cover today. There's other things that I could cover, but there is a summary for all substance use intake assessments. There's always a summary, a diagnostic summary, and basically the summary is supposed to be a brief overview of the assessment. So if someone weren't to go through all the questions, they could just read the summary and get a snapshot of the person. But in the summary, you don't just want to include these very concrete details. Like, of course, these are important. Overview of the substance use, how long the substance use has been a problem, their age and ethnicity, or whatever is in the summary, their legal history and medications that they take, medical conditions. All those details are important, but as well in the assessment, all these things I mentioned, and it could be 1 to 2 sentences. It doesn't have to be super long for each point that I mentioned. You want to be mentioning that as well, because as that person is, well, even before they start the program or at the beginning of them starting the program, you want to consult with the clinical staff and people who are more experienced on how you can support this person with their unique treatment needs. So these things are all so important. Thank you so much for watching this video. If you have any questions, feedback, comments, scenarios you want me to respond to in a video, please email me at maketxbetter@gmail.com. That stands for maketreatmentbetter@gmail.com. The email will be in the description of this YouTube video. I hope to hear from you, and I hope to see you in my next video. All right, thank you. Bye-bye.